Here is a 19-year-old girl fell from second floor and sustained this particular injuries. And so initial where she was presented with shock and initial resuscitations were done. At fifth day, patient was to tertiary care, and by the time patient lactate is normal. And am I audible?
Yeah, now you are, but it is the voice is trailing away.
Okay. So for rest of you,
shut off your, just close your video, then
okay.
your voice will be clear.
Let me just do.
No, it's okay. You can just speak closer to the microphone. Speak closer to the microphone.
Yes. Yeah. So initial resuscitation part was done in some other hospital, and by the time patient presented to me, patient is stable, and then her lactate levels are okay, and hemoglobin is good, and this is the diagnosis. But they have not done any external or internal fixation. So patient had right shaft femur fracture, associated both column fracture with posterior wall, and anterior ring injury, and right SI joint injury, and sciatic nerve injury on that side. So all this, and with this, so at this point of time, patient was stable. And to start with, I'll take you to the steps. The initial fixation was in supine position with a bolster underneath the knee. Shaft femur fixation was done, followed by pelvic fixation with anterior pelvic ring and reduction of the anterior pelvic ring, and iliac wing fracture from periphery to center for the acetabulum. But for ring restoration, first was the first preference. Then went ahead posterior iliac wing fixation, anterior to posterior screw fixation through iliac window, and SI joint screw fixation in a supine position. And it was a prolonged surgery. Patient was, taken out of the theater, and took her again after 3 days, column and wall with osteotomy. That, sorry, yeah. So this is the final picture. It was comminuted wall, which was where a spring plate was used, and GT osteotomy was done. So, and that is the follow-up of the same patient. After 8 months, the fractured shaft femur is healing, and rest of the fractures are healing, and that is the function at 8 months. And today I call that girl for her follow-up. That is her today's video. And I could not get the fresh X-rays. And to conclude, so this was the 2.5 year follow-up, the last video. The shaft femur fixation, especially in combined pelvic fractures, takes the priority with distal femur nail, which has got an advantage, which can be done in supine position, needless to take a lateral position. And pelvic ring stabilization is the next priority, followed by acetabular reduction. That's the message. Thank you.